Tonight in medical rounds, with warmer temperatures finally here, that means springtime sports are gearing up. And unfortunately, with that comes sports-related injuries. Joining us live now is Dr. Kristopher Ware, orthopedic surgeon and sports medicine specialist at the Hartford Healthcare Bone and Joint Institute. Good evening, Dr. Ware. Thanks for being with us tonight.
Good evening.
Well, tell us first, what are the most common sports-related injuries you see?
Well, during the spring season, overuse injuries are very common. These are typically minor sprains and strains, but sometimes they're more significant injuries that can really alter an athlete's season. In my practice, I most commonly see knee ligament injuries, including ACL tears, hip labral tears, and rotator cuff tears.
Yes. Now, what does the treatment typically involve? I'm thinking of that old acronym RICE.
Yeah, so starting with RICE is important. And for most of our overuse injuries, conservative treatment helps. So after RICE, we start with activity modification. We look at volume and intensity of training. We look at footwear. And sometimes physical therapy is necessary. For our more significant injuries, like knee ligament injuries and shoulder injuries, we start with conservative treatment, but in some cases, surgery is needed.
All right, let me just spell out for our viewers who are wondering, what does RICE have to do with, with the healing? It's rest,
Sure, I can do that.
Okay, compression and elevation,
Compression,
right?
Elevation.
All right.
You got it.
Okay, now you are a sports medicine specialist. What advice do you have for athletes to try to avoid these types of injuries?
The most important factor in preventing a sports injury is your preseason preparation. So it really involves a comprehensive program of agility and strength training prior to the season. You also have to address any biomechanical problems that you have with either your running or your throwing. Once you're in your season, a proper warm-up is needed before practice and before games. And you should recognize the signs of fatigue, like loss of focus or loss of coordination, that can predispose an athlete to injury.
All right, Dr. Ware, we have just a few seconds left. If you could answer this quickly, that would be great. When should you seek medical attention? A couple days if it's not better?
Yes, or if you have visible deformity, swelling, or inability to bear weight through a limb, you need to see a physician.
All right. Thank you so much. Well done. Thank you so much, Dr. Ware, for sharing your insight with us.